This video will cover the basics of Dopplers. This is a concept that was not covered in the ACT Foundation ultrasound course, which is why we're going to cover this in this course and via this video. Understanding Doppler is going to be important in doing ultrasound guided procedures. We're going to cover the basics of Doppler principles, differentiate among color, power, and pulse rate Doppler, learn how to use Doppler by adjusting the window, scale, and gain, and appreciate the relevance of Doppler in ultrasound guided procedures. As we all know, if an object does not move, there won't be any change in frequency for the Doppler, and there won't be any Doppler shift. If the object moves toward the probe, then the frequency increases, and if the object moves away from the probe, the frequency decreases. In order to get the biggest Doppler shift signal, we need this angle of insulation to be as low as possible. This angle is created by the direction of the ultrasound beam and the direction of the object that you're scanning at. In this case, the direction of the blood velocity, the blood flow. Increased Doppler shift can be done by increasing the frequency, increasing the blood flow velocity, and as we discussed, decreasing the angle of insulation. This is a diagram from POCUS 101 that illustrates the differences of Doppler shift based on the angle of insulation. Here, if the ultrasound beam is parallel with the blood flow, i.e. the angle of insulation is 0, then you have the maximum Doppler shift. If the angle of the insulation is 90 degrees, meaning the ultrasound beam is perpendicular to the blood flow, then there won't be any Doppler shift. Let's talk about color Doppler. Color Doppler shows the direction and velocity of flow within the user-defined field of window. Here, this is the user defined field of window here, and we're looking at a vessel that has blue color signal. The brighter pixels has higher velocity, and the darker pixels has lower velocity. Let's talk about the color. When the blood moves toward the probe, you have a positive signal, and that leads to a red color. Once again, when the probe is perpendicular to the blood flow, there's no signal. When the blood moves away from the probe, you have a negative signal and it's shown in blue. So we have a mnemonic called BART, blue away, reds toward. So the color, this does not mean artery or veins. The color just means the direction of the blood flow in relationship to the probe. So here, this is red as shown by blood moving toward the probe as seen in the diagram A. Here in B, as you can see, the signal is getting less and less as I tilt the probe. And in C here, now you see the color change from red to blue as I tilt the probe the opposite direction, indicating the blood is moving away from the probe. To use color Doppler appropriately, we need to adjust 4 things. First, obviously activate the color Doppler. Second, adjust the area of your interest. Third, you want to adjust the scale appropriate to the kind of blood flow that you're trying to detect. And fourth, you want to adjust the gain so that you're only looking the color Doppler within the object that you're caring for and not too much gain resulting in seeing Doppler signal outside of the object that you care for. So adjusting the area of interest as shown here is important. Then you want to adjust the scale. Because if you decrease the scale too much, for example, here, now we're picking too much signal, leading to this concept called aliasing. But if we increase the gain, the scale too much, as shown here now is 75 centimeters per second, then we are not detecting all the blood flow that is necessary. You're only detecting the central part of the vessel where it has the highest velocity, and you're missing the lower velocity that is surrounding the wall of the vessel. And so to be appropriate in picking up the signal, you really ought to have the scale be just right so that you're getting the Doppler signal of the entire vessel. Next is adjust the gain so that the signal is within the object of interest. Here, if you decrease the gain too much, then you see no color Doppler signal. But if you increase the gain too much, then the gain just bleed out everywhere. So you want to adjust the gain just right. Let's talk about power Doppler. Power Doppler shows the magnitude of the flow only, and therefore you only see the orange color. It's non-directional. But the advantage of power Doppler is that you can detect low blood flow. So the velocity scale shown here is going to be a lot lower than the color Doppler. It's also less angle dependent. Power Doppler is very useful to detect small vessel blood flow, such as in the peripheral veins, or the vessel in the abdominal vessel walls, or the intercostal vessels, for example. Pulse rate Doppler is a different kind of Doppler. It is the emission of sound wave impulses that allow the measurement of Doppler shift at a precise location. This precise location is shown as a sample gauge with the double line here. It has limitation on the maximum speed being detected. You can also have angle correction to allow for the most accurate velocity measurement. Just to tell you what all the different lines means, this is the line of insulation. The double line, once again, is the gauge or the sample gauge where the velocity is measured. And the slanted line is the angle of insulation of the blood flow. If the blood moves toward the sample gauge, then you have a positive signal, and the signal is above this baseline. If the blood flow is moving away from the sample gauge here, then you have a negative signal, and you see a negative wave below the baseline. And why does it matter in terms of doing procedures? Sometimes pulse rate Doppler is helpful as an additional tool to differentiate between artery and veins. This has been tremendously helpful, especially trying to access femoral veins or deep subclavian veins that is really hard to detect because of the increased distance to detect color of power Doppler signal. And so then sometimes using pulse rate Doppler will be helpful to differentiate between artery and veins. Also, sometimes this is very helpful to differentiating between artery and veins if there are a lot of edema surrounding the vessel, resulting in difficulty in seeing true artery and veins. Here, this is an example of the venous wave, and this is an example of the arterial wave. In our situation, we don't really worry as much about whether we're detecting the maximum velocity that we care about. We just want to be able to differentiate between artery and veins, especially we cannot compress or use color power Doppler signal to differentiate the two vessels. Here is a video on some of the adjustment that you might want to consider, similar to the color Doppler. Here you press the button to see the arterial waveform here. You can adjust the gain once again to make sure that the gain is appropriate within the vessel that we're looking at. You can adjust the sweep speed, which affects how fast the detection is being done. This part is not as important for procedure per se. And once again, we can adjust the angle of insulation. For the Philips machine here, you can adjust it via the quick angle or the angle correction. Right now it's using the quick angle. And now they're going to use the angle correction to make sure that we are detecting the velocity along the blood flow. And lastly, you want to adjust the scale as well so that you are detecting the appropriate blood flow, not too high or not too low.